The report from the Uganda Bureau of Statistics for the National Household Survey results shows that about 7 million Ugandans live below the poverty line, 5.3 million in rural areas and 1.7 million in urban settings. Karamoja tops the list with a staggering 74.2% poverty rate.
16.1% of the total population that are below the poverty line translate to 7 million Ugandans. So nationally, we have 7 million Ugandans below the poverty line, and still the distribution in rural urban, many of them are in rural areas, 5.3 million, and in urban areas we have 1.7 million. Over 900,000 of the 7 million poor people who come from the 16.1% are from Karamoja region. Their poverty rate is 74.2.
During the launch of the UNHS at Hotel Africana, Amos Lugoloobi, Minister of State for Finance, Planning and Economic Development, pointed to ongoing issues like school dropouts and underutilization of free education, urging parents and communities to act. However, he noted that while poverty has declined from 20.3% to 16.1%, millions still struggle to meet basic needs.
We experience challenges in terms of education. The high school dropout rate, the percentage that is actually going for primary education, and the situation is getting worse as we get into secondary school. The children who are supposed to be in secondary school can only be we are only experiencing a situation where only 26% enter secondary education. And this is very disturbing. We need to ensure that all these children graduate from primary to secondary. So there's a challenge which you need to address, both the government and the parents themselves, to ensure that these children take the opportunity granted by the government to get free education.
While reading the health report, Apio Sharon Basala, the head of statistics department at Uganda Bureau of Statistics, highlighted a rise in illness cases, with 21.2% of the population reporting being sick, up from 19.4% in the previous survey. Despite this, rural areas saw a slight drop in illness rates. The report also shows that there is a decline in people who get sick in rural areas compared to those in urban areas, with 20.6% in 2019 to 2020 to 19.2% in 2023 to 24.
And as we are all aware, our health strategic investment plan policy, that's what they look at. Every household should be within 5 kilometers from the health facility. And we are glad that 90% indeed are within that distance.
UBOS emphasized that the survey results must guide Uganda's next steps towards inclusive development.
Now, the Uganda National Household Survey is one of the Bureau's flagship surveys. It provides a comprehensive picture of the socio-economic well-being of our population, touching on critical dimensions such as poverty, health, education, employment, housing conditions, and access to public services. This data is indispensable for assessing the progress of our national development goals, including the parish development model.
Story compiled by Joseph Muyingo and Prosi Chontawaire.